Hi guys, this is Dr. Samali Azad. What I'm going to do today, go over some of the structures of the upper respiratory tract and talk about how the air enters into our lungs. And then after that, we're going to talk about that when the air gets into the lung through the different parts, including the larynx, trachea, and the bronchi. We're going to be following it after that. So, in the beginning is that if you look at this structure here, the air is going to be coming through the nasal cavity. Right in this section of the nasal cavity, this is known as the vestibule part. And the vestibule part is the one that contains the hair that filters the air as it comes right there. From there, the air is going to be entering right introduced to this cavity. This cavity is going to be covered superiorly here by the base of the skull, and inferiorly is going to be by the hard palate. It is, as you can look at this structure, you can see there are some bumps. These are known as turbinates. The turbinates are three of them: superior, middle, and inferior turbinate. Also, they call them conches. Depends which one they say, superior, middle, and inferior conches. Then, right between them, you can see these passageways. These are known as the meatus. Superior, middle, and inferior nasal meatus, which contain some of the fluid that are secreting right through that section. From there, air is going to get to this area, which is the back side. This little opening in this section here, this opening is known as the internal nares or choana. From there, we're going to be entering to the first part of the pharyngeal part, which is known as the nasopharyngeal or nasopharynx. Nasopharynx starts from here. The structures that are associated with that one, number one is going to be the eustachian tube, and the other one is going to be these adenoids, also known as pharyngeal tonsil. From there, it's going to find its way and terminates right at this level. Everything from this all the way to this section known as the oropharynx part. You can see the location of the uvula, which during the swallowing, this one going to come back, close this section, so the food cannot find its way all the way down. There are some sinuses as associated. Remember, sinuses are the cavity within the bone, such as this is a sphenoid sinus, and also this is a frontal sinus that sits right above the supraorbital part. They are the ones that contain air that give the richness and fullness that you have in your voice. Of course, some people breathe through the oral cavity, which comes all the way down through this small opening, gets to the oropharynx. Then you have this section that starts from down here, where the location of the end of the epiglottis, all the way down to the beginning of the esophagus here. This one is known as the laryngopharynx, and this is an opening into the trachea. You can see the epiglottis. This is a thyroid cartilage or Adam's apple. You can see in this one, this is a true vocal fold, and this one is vestibular fold or the false vocal fold. And from there, the trachea is going to be extending all the way down to the level of the T5, which we're going to be discussing those things in the next video. Thank you for watching, and I hope that you enjoyed it.